Thank you so much for that. I'm Heather Gagliano. I'm a registered nurse with a Master's of Science in Nursing. I'm the Operations and Education Director with the Idaho Immunization Coalition.
Good afternoon, everybody. Thank you for having us. My name is Karen Sharpnack. I'm with the Idaho Immunization Coalition, and I'm the Executive Director. And by the way, we're going to flip back and forth because we're in a hotel room in Pennsylvania. So you're going to have to just kind of play with this a bit.
Thank you, Jocelyn, for pulling up our slides. We don't have any disclosures for this. Next slide. So today we're going to be talking about a few different things. I thought the title of the presentation of immunization compliance policies and misinformation in schools was a great one. So to go through that, we're going to hopefully learn about the immunization rules in Idaho, talk about our rates in Idaho. We're going to talk about a little bit about misinformation and different reputable sources. We're also going to talk about some of the legislative updates that we have seen over this past legislative season, which is always an interesting topic to talk about. So next slide. So before we go on, let's talk about why vaccine rules are important. You know, if we have rules, they should be there for a reason, and why are they there? And it's just a great grounding reminder that vaccine rules are there really to help reduce that risk of vaccine preventable diseases in children. And when they're in schools, they are in close quarters, kids get sick, and transmission for these communicable diseases is a lot higher. So that really helps to have those rules in place to help prevent the transmission of these diseases and from kids getting sick. They also help the school's response. So in the case we do have an outbreak of a vaccine preventable disease, it helps the schools determine, you know, who they need to talk to, who's most at risk, if they're vaccinated, if they're not. So that's why those are important for those two different reasons. We do see vaccine preventable diseases in Idaho. You know, we talk about them. Sometimes we think about them as not being around anymore, but they very much are still around. In 2023, we had 10 cases of measles, which we hadn't had measles in Idaho for many, many years. And they have come back, unfortunately. Knock on wood, we haven't had any cases so far in 2024, but we did have quite a few in that 2023 time. We have seen so far this year 25 cases of pertussis, which also is a highly contagious respiratory disease that really can be impactful and detrimental for young children. Next slide. So what are the immunization rules? So for most of the school nurses and administration, they already know those rules so well, but just again, as a ground setting for anyone who might not happen to remember what they are, there are rules put out in Idaho code that state that children need to have certain vaccines prior to entry to school. And it depends on the student's age, the grade they're going into, on what those are. I want to point out that the vaccines that are recommended by ACIP, or that vaccine schedule that really helps protect children and anyone, for those recommended vaccines aren't all required. So you'll notice that we don't have HPV is not on there, flu's not on there, COVID's not on there. These are just the ones that are put into rules stating that these are the ones that have to be put in. But as healthcare providers, we really should be recommending all vaccines to protect children against all vaccine preventable diseases. And I want to point out also, when you're looking at this, you know, at kindergarten to sixth grade, if a student is, you know, we report out school rates and which students are vaccinated or not at, you know, kindergarten, first, seventh grade, 12th grade. So there's those various grades where you're actually putting in a report. But just because you're not putting in a report in for that year, like fourth graders or fifth graders, they still need to adhere to those school rules of actually being up to date on those vaccines. So we've talked about what the rules, you know, what the rules are, why they're important. Let's hear from Karen, who can really talk about the policies and that have gone in, or sorry, the legislation that was talked about and discussed, and the different rules that were potentially put in or looked at during this past legislative season. Next slide.
Next slide, please. Well, as you can well imagine, vaccines are a hot topic for Idaho, uh, as well as across the United States. So throughout the United States, there was over 400 vaccine-related bills. Speaking for Idaho, last year we did see 25, and this year we saw 14. As of today, we sine died, which means that the House and the Senate have said we're done. But that doesn't mean we're done with the session. I'm going to just do a bit of level setting. What happens now is the governor needs to sign the rest of the bills if he has not done it, or he has to veto them. If he vetoes the bills, the legislature has another 5 days. So he has 5 days to do that. Then they have another 5 days to come back. That if they have, then they do have a supermajority, they can come back and override his veto. So in a sense, we are done with the session, but also we don't know until everything's done. So again, we're all excited today because it has been a session. As you can see, and I know you can't see the details, but there were several bills that we look at as an organization. So we are the advocacy as part of everything that we do. Part of what we do is advocacy. So we are the voice to bring in like-minded organizations, like-minded people to help us either stop the bills from moving forward, monitor the bills, or actually pull bills in a positive way forward. And so there were a few that we really took an eye on and we really worked behind the scenes. One was the vaccine for the assessment board. So every 5 years, there's a sunset for the Vaccine for Children program that needs to be looked at and okayed through the insurance. So this is the insurance department, even though it's vaccine related. So we worked very quietly behind the scenes with the assessment board, and it did pass through. This is a huge deal because this means another 5 years we have this in place. The end goal is that we do not have to do a sunset every 5 years. This is just an automatic law and we move on. So that'll be our next 5 years that we hope that will happen. We were hoping this year, but it didn't happen. The other bill that was very, very important to us was the Iris bill, which is I'm sorry. Iris, I'm not, what does Iris mean? I'm sorry. So it's a registry bill, the vaccine registry bill. Sometimes people don't know what Iris is. So currently, and we have been since 2010, when your baby is born, you're automatically in the vaccine registry. So if you choose to as a parent, you can always opt out of the vaccine registry. We make it very easy. There was a legislator, for whatever reason, this is the third time she's done it, she truly believes it needs to go back the other way, where the parent has to put yourself into the registry. So it's an opt-in bill. This was really going to be a very challenging bill on every level. So we actually fought it quite hard. With that said, it did pass the House, but when it got into the Senate, it was held by actually that legislator. So this is a positive thing moving forward. A lot of education, a lot of talking to our legislators. A lot of parents were getting involved. We testified, we wrote letters, we made phone calls, we put op-eds. I mean, there were like-minded organizations along with thousands of people. And believe it or not, it was thousands who came forward to say, this is not a good bill. The other bill that we were looking at was, and there was good intent on the legislator side, but how it was written, it didn't come across that way in the House, where it was, we are not going to mandate vaccines in schools anymore. And that was not her intent, but that's how it was written. So we assisted with having some additional rewriting and amending of what that might look like for the intent she had. Because it went really fast in the House, it did pass the House, but when we got to the Senate, she held it at that time. It wasn't the intent to change that, but those are the bills where we were actually looking at. The other ones were either monitored, didn't get anywhere, or didn't get on people's pockets. The one that did pass through that we just kind of took a step back on was to say, if you're 18 years old, you have the ability to exempt out of vaccines. Well, that's already in code. This is already a law. For some reason, it was rewritten, because sometimes you can rewrite bills with a couple of words to say it again. And so that bill actually did get passed through. I'm going to say it is what it is. So you'll see, as when my next slide comes, there are times we monitor the bills going, well, that's not really going to make a difference in what we're doing. And then sometimes they're like, we're going full force like we did. And other times we're going to help move a bill forward. So this is something we do, is as a coalition, because we are a collective group of people who come together to have one voice. And so we bring the group of people together to have one voice in the legislative session. And all the great work that everybody's doing in the vaccine area, you do have to have really good policies and rules and laws and bills in place. So you do need to have somebody who convenes this. And we've been lucky enough that this is part of our organization that we're able to help this way. Next slide, please. Okay, so I did mention the Bill 397, which was the IRIS bill. And this is a few things that we did. This is why it's important. 90% of what we do behind the scenes, because I do have 3 lobbyists and I actually have a full-time marketing comms organization that works on this with us. So we are very quiet. We're actually called Get Immunized Idaho. So yes, we are the Idaho Immunization Coalition, but our advocacy group is called Get Immunized Idaho on purpose so that we're able to not draw attention to ourselves. So because we did reap our head out of like the water this time on this particular bill, so now we got to be seen, and we haven't been seen in 5 years. Everything else we've done for the past 5 years, it's all been behind the scenes. It's all been very quiet. It's all been education. It's all been talking to legislators. But now we needed to actually be out there. So one of the things we did was we put a one-pager together. And the one-pager gives the legislator an opportunity in less than 5 minutes to read about what this bill is. We give the facts. We talk about how much money it's going to cost. We talk about the outcome that it may have. And this happened to be a bill we were trying to stop. So when we were sharing with this bill, just from the state of Idaho immunization program, it could have been upwards of $750,000 to change over that bill. The other part is we found out it was going to be about $10 million across our state for providers to change what they needed to change over. Outside of all of the other issues that were going to be there, we also, bottom line is, it usually is dollars and cents that makes the difference. So we were actually calling you to attention that this was going to be a huge lift for our providers in our state. The other thing is, you see, we do testify. We don't bring 100 people in. We bring in 4 or 5. We are very strategic. We talk about talking points. We talk about messaging. We build a story together as we go in and have it. So we're not having everybody say the same thing, or we're also not having like we're missing opportunities of, oh my gosh, we had a hole. So together, it's part of my job to actually say, okay, this is the message we want to bring forward. This is the message we're going to want to bring forward to that particular legislator who may or may not be like on the fence, that we're going to get a constituent in his or her area to come and speak. So now they're hearing for their constituents. On the right, again, I know you don't see this, but it was more visual so I can talk. We do a lot of calls to action. So letter writing. So we will do a call to action. We have about 3,000 or so, actually more, stakeholders we can send this out to and saying, hey, this is the bill. Here's the overview of what this bill is. We want you to contact your legislator. So we'll have 3 or 4 letters that you can pick from. You can read them over, write your own letter, and then you push a button. And when you push that button, it gives all the legislators' names, and you sign your name. So we're making it as simple as possible. We also ask to make phone calls. We also ask if you know somebody, we will do the right people to have those right conversations. So as we're going on and saying, this is who we need to talk to, we will find the right people to go in and talk to those legislators. So again, I'm going to go with this bill. There were 7 senators we needed to have conversations with. It already passed the House. We're into the Health and Welfare Senate. 2 were for, 2 were against. We had 3 on the fence. We concentrated on those 3. I mean, we concentrated. So they got hundreds of phone calls. They got thousands of letters. And then they had breakfasts and lunches and they had meetings. They were barraged by amount of people coming and talking with them. And we just, not anybody. It was a strategic thought process. Who is going to make the most impact if this bill moves forward? We also, for this bill, this is being transparent, we got a hold of the governor's office. We wanted them to know, what is the impact if this bill moves forward? We are not saying that the governor was going to veto it, but he actually came back to our organization and said, I want research on A, B, C, D, E, and I need it within the next 4 hours. Stopped my work, got everything he needed. So then he was educated on, what if this bill gets passed? What does this look like for Idaho? How does this, hurt children? How does this hurt families? What is the impact on providers? So when we actually go out and we actually advocate, this is how we advocate. And so, but I'm going to go back to, this is not what we want to do. We want to do things behind the scenes quietly so that we are not out and about all of the time. But with that said, now I'm going to challenge you all. So I'm like pulling this forward. We would love, and like Dr. Noreen Wallach is part of our organization that I have reached out to when we've needed to say, hey, I need this amazing provider who actually has a voice, who actually can help us. If you would like to have a voice with us, please let Heather know, because we can put you on a list. We can send you out, periodic emails. We're not going to like sell them or do anything with them, letting you know what we're doing as an organization. But we will have school rules that are coming up. Daycare and school rules. We'll have public hearings this summer. And then all rules have to be open every 5 years. The school rules are being opened up in this year, and then January they're voted on. We have to get the vote to say, yes, they're staying where they're at, and we want them in place, because there's always a chance things can come out, or the legislature could actually just wipe them out altogether. And like, there's no school rules. I'm not giving you worst case scenario, but we are really going to be working on the fact that we want people to stand up and saying, yes, we need to keep this in place. So just as an FYI, if you would like to be involved in this, we can reach out to you and have you do as simple as writing a letter, or if you want to testify, or if you have an organization that you want to work with, or a superintendent or two online. Hey, listen, I can work with you and your schools and your school nurses and your teachers to say, this is important to us. So next slide, please. I'm going to actually hand this over to Heather for this next step of things. Thank you.
Thanks, Karen. So let's talk about where we are in Idaho when it comes to school immunization rates. So as we talk about, for school nurses, very familiar with the concept of herd or community immunity, that so many people need to be immunized against a vaccine preventable disease to be able to prevent that from then spreading throughout the communities. Typically, we're looking, for each disease, it depends, but like for MMR, it's 95% need to be vaccinated to prevent the spread or prevent if the disease was introduced, to prevent it from easily spreading within the community. So these are Idaho rates that are published. They're available on, you can see them on the CDC website, or Health and Welfare has them available for different school years. So you can see the 2011-2012 school year, the different vaccines and how many kindergartners were up to date. For example, for ones with diphtheria, tetanus pertussis was 89%. And then in the 2022-2023 school year went down to 81%. Same thing, MMR, we want that 95% of children to be immunized and up to date, because that helps reduce that potential spread of disease. It is in 2011 school year, 89.2%, 2022-2023, 81.3%. I actually just recently, the other day, received an email from the Idaho Department of Health and Welfare with some preliminary numbers on this. So for the 2023-2024 school year, so for that, our MMR numbers went down below 80% of children being complete to 79.6%. For those complete on polio, 80.1%. Were complete. So you can see they're going down. So let's talk about the other graph below, where it's kindergarten exemptions. So you can see the medical exemptions for the different school years are remaining pretty similar and the same. In 2024, so this 2023-2024 school year, it was 0.2%. So not very much of a change. But let's talk about those non-medical. So in those 2011-2012 years, 5.1%. Last school year, it was 11.15%. We jumped pretty much 2 points this past to 13.9% on just non-medical exemptions. So in these preliminary numbers for all of those exemptions, it's 14.3% of our kindergartners in Idaho are not protected against vaccine preventable diseases. So kind of big numbers there to digest. Let's talk a little bit about some reasons why that could be, because again, medical reasons are staying pretty much the same. So it's the non-medical reasons. Next slide. So in Idaho, people can exempt for a variety of reasons, medical, religious, philosophical. So if we're looking at the philosophical and misinformation that might be there, I wanted to highlight here. There was a study a report that came out of the Center for Countering Digital Hate. It's a US UK nonprofit, and it did a report that over half, so 67% of misinformation that's out in social media is actually just being created and by 12 people. So these 12 people create it. So it's not necessarily truly shared by 12 people, but they create it and then it disseminates out. And so they were able to track, just anyone, your neighbor or, the grocery store owner, people, just average day, everyday people who were reposting this, they were able to track the originators of those to just 12 people. So again, even though we have people who have these misinformation, it's not the majority who are producing it. It's actually just a few people, but it's individuals see that they sounds like it's real, something could be there, and then they reshare, repost, like things like that. So as nurses, as medical providers, as educators, it's important for us to actually, when we're participating in social media and while we're sharing information, we want to make sure that we're sharing very factual, scientific, evidence-based information. And that can be difficult. Next slide. So let's talk about how do you spot fake information. This is a really cool graphic from the International Federation of Library Associations and Institutions. I have a link to this resource at the end with, in my sources that you can pull up, and it doesn't look exactly like this one, but it talks about how to really spot that fake information. So as nurses, if we see anything on social media, if we hear something, again, we want to be able to consider the source. Who did it come from? We want to actually, if it's a headline, because news organizations, as great as they are as reporting things, they're there to catch us so we can read them. So we actually need to read beyond the headline and actually see what's within there. You want to be able to actually check to see who the author is and if they're credible. You want to see, it says consider the source, but it's really considering the sources. Do they cite their sources? Check the date. Is it new? Is it an old article? Is it something that came out recently? Sometimes things are jokes and gets reposted and people then glom onto it thinking it's real. There was a whole joke that was talking about how birds aren't real. And there was a joke along that, birds are really spies, they're machines, they're not really real. And it started off as a joke. But oddly enough, there were some people who took that joke as reality. So it's important for us to look at that. As crazy as that might seem, but people really started to believe that. With these, you want to make sure we're going beyond just those headlines, but actually reading medical journals, reading articles. There's some great information on the School Nurses Association website that actually provides really good information, factual information about immunization. So if you're ever wanting to share this about, gosh, where are you hearing information from parents, from other people that your coworkers, again, that International Federation of Library Associations actually has a really good graphic that you can share to help them understand how to go beyond that headline. I had a friend who actually shared in the middle of the COVID-19 pandemic a headline that sounded like they were quoting a peer-reviewed journal, sounded like it was, from a physician. It seemed really real. And I was able to take time through that, looking at, okay, who's the author? Was it really a journal article? And actually dissecting it down, the person who wrote the article didn't believe AIDS existed. And so when you talk about, is the author credible or not? If they don't believe that a disease exists, that's kind of leads some questions into that. They also continue to claim that they were a physician, but their actual license had been stripped from them when they were over in UK. So it's just really good information that you're looking for to go beyond there to get that and find out if it's good information. Next slide. So how do you talk to people? So you're there letting people know what the school rules are. You're advocating as healthcare providers, as members of the community, that vaccines protect children. How do we want to address misinformation? So there is a pamphlet that is created by Frame works that really talks to people about how you address misinformation. And I think that that's on the next slide, but this is a really good step in how you talk about it. So you want to talk about what the facts are first. You want to say, hey, sometimes people think there's a little bit of misinformation here. They might think this. You explain why the facts might have been misinterpreted, or if someone intentionally misinterpreted that information, and then again follow it with correct information. So you want to sandwich the factual information, warn them that they're going to hear some incorrect information, and then what that incorrect information is, along with what that factual information is. And it's important to actually sandwich it, because somehow our human brains, even though we might hear that something's misinformation, we tend to then go, oh, I remember that was the last thing I heard, that maybe there's some credibility to it. So this is a way that's been shown to really help address that misinformation. There's another toolkit that I put a little picture of. It's out of the Office of Surgeon General that talks about a community toolkit for addressing health misinformation. It's on the resource page. I highly recommend clicking it, printing it out, and really looking at the process of how that misinformation is being utilized, how you can address that misinformation, and utilize that and test it out and see what seems natural and works best for you. Next slide. So this is the frameworks I was talking about. It's really reframing how we discuss and talk about vaccines. And this is evidence-based. It's really kind of a really great guide. Again, recommend reading through it. It's 40 pages, which seems long, but I went through it very quickly, and it's chock full of amazing information about how we discuss and talk about vaccines, how we can just reframe that discussion can really impact people's uptake and understanding. So for many years, we talked about immunizations, being there to defend ourselves, defend our body, it fights disease. And we found, and through this, this pamphlet they talked about, through research, they found that actually wasn't really sitting well with people, that they actually preferred the idea of the analogy that the vaccine was like a trainer, and it was working in conjunction with the body to help your body prepare to fight off diseases. So it's your body is the one who's doing the work. The vaccine's just there to help coach it, help prepare it. But again, it's the body that's actually doing that. So highly recommend this as an amazing resource for anyone. Anyone going on vacation, getting ready for summer, it's coming up, a few more days, a few more months, or a few more weeks. If you're going anywhere, this is a great one to read. Next slide. So we talk about, misinformation. Let's talk about factual information. So again, when you're looking at factual information, you still want to make sure that you're, checking all of those resources, but if it's a new factual place for you, to make sure it is factual. But once you've confirmed it, Centers for Disease and Control and Prevention, they're a great resource. Immunize.org, if you're not familiar, has amazing resources for not only the public, but also for healthcare providers on how to talk about vaccines, information about them, and the diseases they prevent. American Academy of Family Physicians has a really great patient care prevention wellness, how to talk about immunizations with families. Voices for Vaccines has this really cool thing called a vaccine quest. So if you yourself don't feel very familiar with vaccines, you might feel like maybe, yeah, I know I'm supposed to talk about them, and gosh, I remember talking about them in school. But if you want to go a little bit further and learn about vaccine development, how safety is regulated, all of that, there's this thing called the Vaccine Quest, that is a self-paced module that you can go to. And I like the idea of it's a quest going through and learning about them. But I've gone through it myself, very educational, and helps provide some really great information. At the same time, I also want to talk about great factual information from the Idaho Immunization Coalition. We have our Immunization Summit coming up on December 10th in the Treasure Valley area. So if you want to learn more about that, I don't know if, Kim, you can drop my email in the chat, or I can do that later. You're welcome to get on our mailing list, and we'll let you know about when that's coming up. But we're going to have some really great speakers, very factual information, some really great information about immunizations, great connections with others, along with, as Karen was talking about, learning how to advocate and have your voice be heard when it comes to the importance of immunizations. Next slide. So that's some great resources for you. That also has information for families. Let's talk about for some students and families. One of the things that you might find is there's a resource called Docket, where it's an app. I mean, they have an app for everything. And it actually gives people access to their immunizations and their children's immunization records. And it comes through, if they're in Iris and a couple of other states, they'll actually go ahead and pull it in, and a parent can get that on their app. So it's great for school nurses if you're looking and you have a parent who forgot to contact their provider, or it's for some reason you aren't able to look them up on the computer. They can actually pull up Docket, have their information, their immunization information, and then email out or print it if they need to. And then it also gives you reminders on it'll tell you, hey, a vaccine is due for their child. It's a really cool resource. So they can scan it and get Docket from there. Vaccines for Children program is a great program for people to actually get vaccines, where the vaccines are no cost for the families. There is an administration fee, and we have providers throughout Idaho who are part of that Vaccines for Children program, so that when you do have children who do need to get vaccinated and cost is an issue, whether they don't have insurance, if they're on Medicaid and other reasons, they can go ahead and get that. If you're wanting to set up a vaccine clinic, or you need to connect your families to vaccine resources, reach out to your local health department. They're going to be the best organization to know who in the area is providing maybe offsite, if they're doing like a back to school clinic or end of year clinic that parents can easily access. Or if for some reason your health department doesn't know, reach out to the Idaho Immunization Program. They're the ones who actually oversee that Vaccines for Children program. I've put their general phone number and email on there, and you can reach out to them. If the parents are needing to get vaccines, they can go to vaccines.gov, and it'll actually help them see where to go get flu shots, flu vaccinations, and it connects them with the Bridge program, which will provide access to free COVID-19 vaccines for those who don't have insurance. The Idaho Immunization Program also oversees 317 programs for vaccines for adults who don't have insurance. They might have some ideas if you have a parent who's needing to get vaccinated in the area on who to call and reach out to, who might have access if the health department doesn't know. Next slide. So you can see all these different sources, but I have some great links for you to click and be able to utilize to get those toolkits. Highly encourage you to print them out or read them. They're amazing resources just as nurses, administrators, to be able to learn about immunizations, learn how to talk about them with families. And with that, I appreciate you guys taking your time and listening.
Thank you, Heather, and thank you, Karen. That was really great. We do have a few minutes for questions, so if you do have a question, please use actually, let me just, feel free to unmute. So I just give you the ability to unmute. So if you have any questions, feel free to unmute and ask, or you can type this in the chat if you can.
Yeah, I have a quick question. This is Tasha. Do you know, with just advocacy in the future, I know recently there was a new push in the code to make sure that school nurses or school districts were very upfront with parents about the fact that we had exemptions available for them to fill out, versus before parents would usually have to ask, if they didn't want to be if they didn't want to be vaccinated, then they would come to the school district or come to the nurse and say, I didn't want to. But now we're putting them on our forms. And I'm wondering if that's increasing, obviously the exemptions, because I'm finding too, it's not even a matter of they actually opposing the vaccines. It's a matter of just convenience. Like, I don't even want to get my kid vaccinated. I'm behind. I'm not going to worry about the additional ones that we need to do. I'll just sign this form and be done with it. And I feel like my hands are tied in that situation.
parents should be educated on what their choices are. And so the information that you're talking about, it is a requirement that we let parents, or the school districts let parents know, hey, listen, you know what? Here, either you get your vaccines up to date or you're actually able to exempt out. So this was something, especially in the last 5 years, that parents didn't know they were able to exempt out. Yes, we have high exemption numbers. Is that a correlation? It could be. It also could be that because of the pandemic and because of what was happening with COVID and all of the other misinformation as well as information that was out there, that parents got a little bit concerned and may not have all of the information that they need to be able to make decisions if they are not able to have conversations with providers or school nurses or whoever it is. So yes, it is. We do want everybody to know that they have a choice. Is there a correlation? My sense is there is. You have to know we have been the highest in the country as far as exemption rates for years. So the 11 years I've been in this job, I think we were number 2 a couple of years in a row, but we're number 1. And it's unfortunate, but this is where we're at. Also, just know as administrators and if you're school nurses, they're welcome to fill out the exemption form that is online that you can get in the Department of Health and Welfare, but they also can do it just on a piece of paper. And the parent can actually just, name of child, what they want to exempt out, a signature and the date. I mean, it could be that simple also. So the rules are quite easy for a parent to be able to have those conversations and to exempt out. And Heather wanted to add on something, so I might be forgetting something. So could you hold on a second? And then we can check to see if we've answered your question.
So, Tasha, you talked about how parents are saying that's kind of the easier choice. Like, okay, they've gotten vaccines, from what I understand, but they don't want to take off. They don't have the ability to take off time, or they might not be able to get into the doctor's office. That's why it's important to reach out to those vaccine providers to try and coordinate maybe a clinic on site, and as a school administrators, welcoming and opening it up so that for people who do choose to vaccinate, who do want to be able to get their kids up to date, they have that option to do it in the safe space, having a school nurse available, having a vaccine provider come in and be able to offer those vaccines. I can't, guarantee if that, if you're able to find that, but that's a good option to allow that and open it up so that students have that, they're already there, get them taken care of, so that for the parents who did, decide that that's why they wanted to do it, say, hey, we're going to work on actually being able to help support you and not only protecting your kid, but also getting them up to date and reducing that barrier of them having to take time off or trying to find a provider. So, I remember seeing that when I was doing school nursing, and it's like, oh, I don't have time. It's like, well, let's help remove that excuse. So.
I have a question. Elizabeth Conrad. Am I on?
Go ahead, Elizabeth. Yep, we can hear you.
I'm a school nurse in a private school. We have 3-year-old preschool, 4-year-old pre-K, plus kindergarten through 6. Am I incorrect in having my 4-year-old pre-kindergartens get their immunizations at 4?
Noreen, do you want to, your hands up, do you want to talk so it's not just me?
Yeah, heavens no. Yeah, you can get your kindergarten immunizations at 4 years of age. There is, there have to be, as intervals between, in particular, well, all of them have intervals that you have to be aware of. But yeah, if if it's appropriate for them to receive their kindergarten vaccines after 4 years of age, absolutely.
Yeah, they share the same building as the rest of the students.
Yes. And I had my hand up to say that, I've always long held that school nurses are our secret weapon to be pro-vaccine. Of course, as pediatricians, that's our job as well. But even the way you guys as school nurses word, when you communicate with families about, oh, it's time for your child's immunizations, even the way you phrase it can 100% make a difference between a family who like, I'm going to sign this, I'm going to get a scrap piece of paper because I'm busy and I'm just going to say I don't want my child to be immunized versus like, oh, okay, I'll get that immunization. I see Hillary Rahill on this call, who I know has organized some of these vaccine clinics that you were talking about, Heather. So, you have power in your position, and families, believe it or not, do actually listen to you. So never forget that.